Hearing aids can't give you perfect hearing, but they should help you hear everyday sounds like the doorbell, the telephone ringing and the kettle boiling. They should also help you follow what people are saying so that conversations become much more easy and more relaxed. If you have been given a hearing aid, then it is likely that you have a nerve hearing loss, which is when the small sensory cells in the inner ear, called hair cells, are damaged. The damage can occur as a result of the normal aging process, disease or injury from noise or certain medications. A hearing aid magnifies sound vibrations entering the ear. The surviving hair cells in the ear then detect the larger vibrations and convert them into nerve signals that are passed along to the brain. Hearing aids are chosen depending on the level of a person's hearing loss and natural hearing levels. Hearing aids come in different power levels to suit the individual's hearing needs. We will fit you with the hearing aids that are most suitable for your level of hearing. Here we are using a Phonak mid-power hearing aid for moderate to severe hearing losses. Hearing aids can also be fitted with a thin tube and a dome rather than an ear mould shown here, but this is only suitable for mild to moderate hearing levels. The right hearing aid will have a red marker near the battery drawer under the hearing aid, and the left side will have a blue marker. To put an ear mould and a hearing aid into your ear, hold the right hearing aid in your right hand, or if you're putting the left hearing aid in, hold it in your left hand. Hold the mould between your finger and your thumb by the handle, the back piece of the mould. Make sure that the back hearing aid piece slides into the hole between your finger and your thumb. Make sure that the part that's going into your ear is facing as if it were facing in your ear. Bring the mould up to your nose and follow your nose up to your ear. Now put the mould into your ear. You can pull your earlobe down with your other hand and push the mould to fit it in snugly. Then feel for the loose hearing aid part behind your ear, slide it forwards towards your nose, then slide it behind your ear as if you were tucking something behind your ear. Ensure that the part of the mould that tucks in at the top is under the flap of skin in your ear. To put the thin tube hearing aid in, hold the hearing aid with the back piece facing towards you. Slide the hearing aid up over the back of your ear. Feel for the tube in front of your ear, grip it and wiggle it into your ear. Then feel with one finger and give the tube an extra push to ensure it is in securely. Some hearing aids have a retention wire which then needs tucking into the bowl of your ear once the hearing aid is in. If the hearing aid is whistling, squealing, sizzling or buzzing, this could be feedback, which happens when sound from your hearing aid leaks out and gets picked up by the hearing aid microphone. If there is whistling happening, you may not have the hearing aid in properly. You can take it out and put it in again, trying to ensure that the mould or the thin tube and rubber dome is correctly positioned in your ear and pushed firmly and snugly into your ear. Another reason that you might have whistling or feedback in the hearing aid is because you have excess wax in your ears. This causes the sound to go into your ear and bounce off the wax, causing the feedback. See your GP or nurse to check if you have wax in your ears. If none of these work, book an appointment to see your audiologist, as the hearing aid may be faulty or you may need a new mould or a new thin tube. If the hearing aid isn't working, check that the ear mould or tube is not blocked and the tubing is not twisted, squashed or split. Check that the battery is in the right way round in the hearing aid, or even try a new battery, as batteries can occasionally be faulty. If the hearing aid is still not working, check whether there are any droplets of condensation in the tubing. Hearing aids naturally are exposed to moisture from your skin as well as the air, which can cause a static sound in the hearing aid, or cause the hearing aid to turn on and off by itself. Keeping hearing aids dry will result in the hearing aid lasting longer. If you are having problems with your hearing aid, then you should contact your audiology department. You should also arrange a hearing aid service with your audiologist every 6 months to ensure that the hearing aid is well maintained. Every 6 months we will provide you with new batteries at your 6-monthly service. To change your battery, remove the sticker from the new battery and wait for 2 minutes for the battery to activate properly. Then open the battery drawer and place the battery in the battery drawer with the smooth, flat positive side facing upwards. Some hearing aids need the battery to go in sideways. If the battery is not in the correct way, the battery drawer will not close easily. Make sure that you don't force the battery drawer shut. To save the battery, make sure you turn the hearing aid off at night time or when the hearing aid is not in your ear. You can do this by opening up the battery drawer. There is no need to take the battery out of the battery drawer. If you are not wearing one of the hearing aids for a long period of time, do make sure that the battery is not kept inside the hearing aid, as it can cause rusting in the hearing aid. You should always carry spare batteries with you so you're not caught out if your hearing aid suddenly stops working. If your hearing aid is not maintained, the sound quality may be poor. It is therefore important to clean your hearing aid regularly. You can clean the hearing aid by wiping it carefully with a soft damp cloth or a tissue. Take care not to get it wet, as this can damage the hearing aid. If you have a hearing aid with a thin tube attached to it, the audiologist will have supplied you with some cleaning wires to keep the thin tubes clean. To clean the thin tubes, unscrew the thin tube and thread the cleaning wire through the thin tube from top to bottom. You can also wipe the dome down with a wet wipe or a damp tissue. This should be done regularly to ensure that the tube does not become blocked with wax or debris, which can prevent the sound from passing through. Ear molds should be wiped clean every night with a soft damp cloth, a tissue or a wet wipe. Make sure you don't use any chemicals on your ear mold, as this can damage it. You can use an unbent paper clip or a similar item to remove any wax or debris that has got into the tube in the end of the ear mold. Every 6 months, the plastic tubing on your ear mold needs replacing. The thin tube on the hearing aid also needs replacing if you have this type of hearing aid. If you would like to do this yourself, you can get spare tubing from your audiologist. Alternatively, book an appointment with your audiologist and they will do this for you. This needs to be done every 6 months. To re-tube an ear mold, pull the old tubing out of the mold. Put the old tubing to one side, then using a piece of pre-bent tubing, cut the shorter end to a taper to allow it to be threaded through the ear mold. Then thread the tapered end of the tubing through the ear mold so that it comes out of the end that usually goes into your ear. When you see the plastic tubing coming out of the ear mold channel, pull the tubing through until it reaches the bend. Cut the tapered part of the tubing off as close to the end of the ear mold as possible so that it is smooth inside your ear. You can then use the old piece of tubing to adjust the length of the tube to fit your ear properly. Do this by putting the old tube on top of the new tube and cutting it to match. You do need to allow yourself sufficient time to get used to wearing a hearing aid. Familiarise yourself with the controls, practice putting it in, taking it out, and changing the battery every week or so. This may seem quite awkward at first, but most people can do this without thinking within a week or so. You also need time to get used to the sound of the hearing aid. Hearing aids allow you to hear sounds that you might not have heard for quite a long time. For example, people often find their own voice appears particularly strange, sometimes even echoey or tinny. People comment that they can hear background noise differently, and overall sound can feel quite loud. Remember, your brain has become used to not hearing as many sounds, and it will take time to adjust to the new sound. It can take up to 3 months for your brain to fully adjust and acclimatise to the sound of the hearing aids. Eventually, the hearing aids sound completely normal and natural. If you'd like more information on managing your hearing loss and hearing aids, See to Hear is a series of free online videos that cover a range of practical aspects of hearing aids and communication. All videos are available via the See to Hear YouTube channel. Just type in See to Hear online.